Hello. It gives me great pleasure today to welcome Dr. Vivek Reddy. I'm Kalyanam Shivkumar, the editor-in-chief of JACC EP, and also we help main JACC with integrated content for electrophysiology. Today, I have the distinct pleasure to introduce a new partnership between the JACC Journal family and a important CME event that was spearheaded by Dr. Reddy called EP Connect, which involves a completely innovative form of CME that has been created and has been incredibly successful in educating practitioners, trainees, and especially and even junior attendings in many academic programs. Vivek, could you tell us a few words about your vision for EP Connect?
Sure. First of all, thanks so much for partnering with us. It's very, very exciting for us, I think. So about 3 years ago, and this was right sort of in the middle of the pandemic, Frank Marcinski and myself, we were talking about the fact that there was a lot of different online content. And one of the things that seemed to be missing is sort of a long form content where you really try to delve into a subject matter, usually a recent publication, but it could also be a general subject. And what we wanted to do was to gather a small group of experts and really sort of delve into it to try to really get beyond simply the surface of what one can do in a standard 10 to 15 minute sort of discussion. Even that, by the way, is sort of longer than many events. So we said, well, let's try to do something where we have a longer format, now basically 90-minute format, where we typically have, for example, an expert on a particular area or a recent, let's say, clinical trial that was published, where we have them present that information, and then we have a moderated discussion. So in the discussion, the idea is to, of course, bring up what was the subject matter of the presentation, but also ancillary issues. And this allows us to sort of try to focus on the most current and updated information. I mean, the way I look at it, and I think Frank and I both look at it, is the exact same, which is we want to we want to have a discussion that we want to listen to. I mean, I'm not kidding when I say that I learn from every one of these sessions. This is not for me. I look at this as an opportunity to broaden my understanding of a subject, and oftentimes I learn a completely new subject, something that I don't really know much about, and it really is a nice way to sort of delve into it. So I guess that was sort of the philosophy. And we're now, what is it, 90 plus sessions in. So far we haven't run out of topics.
That's incredibly well stated, Vivek. And as a participant in many of your panels, I was struck by the background work that you had to put in, and which, of course, was one of the reasons why, as the editor-in-chief of our journal, and after having discussed with the editor-in-chief of Main Jack, Harlan Krumholz, we actually felt that this was a remarkable opportunity for us to amplify scientific content that is relevant for practice um, through this partnership with our journal platform. And I was hoping to actually use this initial podcast as a kickoff, as an intro. And we plan to work with you to bring out special podcasts after national conferences. And also, we have the Heart Rhythm Symposium that's coming up. And that provides really unique opportunities to showcase um, what is new topics, and that's a tremendous opportunity. We are looking forward to that. Um, I would also like for you to make a comment on live cases, which of course has also been a treat to watch on EP Connect. And could you tell us a little bit about how that came about and how you envision sort of keeping it? And we're hoping that you'd continue to expand on that.
Yeah, no, thanks, Shiv. As you know, our field in electrophysiology is undergoing dramatic changes, and it's going dramatic changes in several different aspects. increased understanding of physiology and clinical trials, but also increases and changes in our technology. And both are, of course, go hand in hand in terms of advancing our field. So it was in that context that Frank and I thought, you know what, let's also include some key cases that not just bring out some interesting aspects of the case itself, but also allow us to bring in, again, other recent journal articles and other concepts that broaden beyond sort of the classic sort of case presentation or live case presentation. We're very careful to try to not be repetitive. I mean, the good news is, as you know, because you've been participating in many of these sessions, there's so much going on in our field. I mean, it's really dynamic, all the work that's being done, that it's actually, interesting enough, the hard part isn't identifying subjects. The hard part is picking the good subjects because there's so many good subjects, trying to pick the one and not being able to do all of them. I think that's actually the bigger challenge.
That's great to hear the degree of enthusiasm in what you're saying, Vivek. And again, having participated in this, we are extremely impressed. And I'd like to again thank you for this great opportunity for partnership, and more importantly, to really inspire and uh, sort of give an opportunity for our trainees and the next generation people who are entering our field, just seeing the extent to which that the way people are learning is changing. This provides a great format to amplify content. So I'm looking forward to working with you and the EP Connect team and the CME group that you have identified and you're working with. So we're looking forward to this, and thank you so much for working with us, Vivek.
Yeah, well, thank you, Shiv. I mean, I think we're very excited to virtually be connected partnership with ACC and the Jack Journal family.
Thank you so much.